Thank you, Chad.
Thank you, everybody. And I'm going to try to condense hours and hours and years of information into 3 minutes. I'll try. I'm with the North Dakota Health Information Network, and there's been lots of things going on with health information on a national level since the early 2000s, like the last 10, 11 years or so. In 2004, President Bush basically said that we need to have electronic health records in place by the year 2014. And since then, there's been a wide range of programs and initiatives going on to try to help make that happen. Some of that was pushed along by the HITECH Act in 2009. And really, this transformation for handling healthcare information has been happening. On a national level, lots of things are happening. You know, the old county extension service that you'd have for agriculture, we have that now in health information technology as a direct result of the HITECH Act. And some of the healthcare providers here in the community have been using this regional extension center consulting services, if you will, to help them along in this electronic health record transformation. There's also workforce training, incentive payments to doctors. You've heard of Meaningful Use, I'm sure most of you. This is all as a result of the 2009 HITECH Act. On a local level or a statewide level, you know, we received a grant here in North Dakota to take on money and create what's called a North Dakota Health Information Exchange. And we've called that the Health Information Network. But really back in 2006, on a local level, many of us started getting together, just like we do in North Dakota, right? We get together when we cooperate and we communicate and we get things done. And so back in 2006, Senator Conrad convened the first Information Technology Summit. It was in Bismarck, and Gruby Technologies was one of those initial sponsors, as well as many of the associations around the state. And from that grew many different things. In fact, the legislature got involved. In 2009, they passed a bill that created an Office of HIT at the state. We also have an advisory committee. There's a 24-person board that really oversees this collaboration, oversees this grant money, and really is helping implement this HIT innovation within the state. One thing I want to also add is that the legislature committed at 2009 $5 million for loan money, revolving loan money that would help providers be able to get electronic health record software in their places to help meet this 2014 mandate. In 2011, they expanded that. We expanded our office just a little bit to help manage things, but in 2011, the legislature put another $5 million in, and we've loaned out $10 million so far to healthcare providers around the state to help implement electronic health record software. That's just one piece of the puzzle, though. The real thing that we're trying to do then is get something with this data to make the data start to move, right? And that's where the Health Information Exchange comes in. So we're working with local communities across the state, including Fargo with Family Health Care, Sanford, Essentia, to get information from the electronic health records and make it available to other providers that need it. We don't stay in one spot. We have snowbirds, we have college students. It's important to be able to access the information in those electronic health records. And because of our initiatives at the North Dakota Health Information Network and working through our advisory committee and with the local providers, we're able to do that. We have a clinical portal that's about to become real. In about 2 months, we're going to go live with our first pilot sites, Jamestown Regional Medical Center, Sanford, and Essentia, all working together, where we're going to start actually getting data into the exchange, making it very, very valuable. And I think that you'll see some real benefits from this. We have ways with the way we're pulling this data into the exchange. Doctors can subscribe to their patients, and so if they get admitted into the emergency department at Trinity Hospital, for example, in Minot, but you happen to have a relationship with them here in Fargo, you'll get a notification that they've been admitted. You'll know if they have a lab result that's been finalized and things like that. So lots of things out there. This is just a quick glimpse at what the screen would look like if you were to do a query on a patient, if you're a provider. And the benefits don't really even stop at the provider level. There's also big advantages with the patient level. Quality and safety, of course, should be improved. The duplication of tests, the duplication of services that are there, we're helping to eliminate that. Some other benefits we have: public health reporting. Messages that you have to send now manually to different agencies around the state. Part of your mandatory reporting will be done automatically when you're a part of the network. We have many other features and services. I would welcome the chance to talk with you right out next to the ATM machine if you'd like to talk with me at the break. Yes, the 3-minute police are here. Thank you, everybody.